Hi, I'm Dr. Jeffrey Annamarino from Bellissimo Plastic Surgery and Medi Spa. Welcome to Bellissimo Live. Today we thought we'd concentrate and give you some idea of what it's like and what needs to be done after you meet with me in your consultation. That's usually the time you'll meet with our patient care coordinator.
What is typically discussed with the patient care coordinator?
So once I'm completed my examination and our discussion in the room, I will go out and talk to the patient care coordinator, going over what we discussed, the procedure or procedures that we went over, and that way the patient care coordinator can generate a quote for surgeon's fees, the operating room, and also the anesthesia fees. So she will be able to go through all of that with you. Also, you'll have paperwork that informed consents, anything that if you need some preoperative testing, she'll go over that with you as well, and any type of blood work.
You mentioned testing that would be ordered. What type of testing?
So some of the surgeries that I do, say we were to talk about an upper blepharoplasty, upper eyelid surgery. Sometimes that's covered by your insurance company, so what I would require is a visual field test, and that can be done by your optometrist or your ophthalmologist, and that basically is a test to show if you have a lot of excess skin that's causing some hooding of the upper eyelids. It can show if there's any type of obstruction, and that if there is an obstruction, we can submit that to your insurance company. So that's one. Another one, any woman at age 40 or over that is going to have breast work, breast augmentation, breast lift, breast reduction. I really want to have a mammogram that's within the past year and obviously within normal limits. Sometimes ladies that are 35, 36 with a family history, they would also have one.
What about, you mentioned also medical clearances.
So the guidelines are anybody over the age of 50 would require an EKG. I usually will get a complete blood count, which is some blood work, and also some type of a monitoring panel that will go over your electrolytes, and sometimes a kidney panel with that and a liver panel with that, depending upon your past medical history. Under the age of 50, then patients that have a history of cardiac disease, hypertension, diabetes, anything like that, then you might need some blood work before that as well.
So once I've met and had my consultation with you and a treatment plan has been determined, I meet with the patient care coordinator. Do I have to schedule after I've met with the patient care coordinator?
So no, you don't have to schedule surgery at that time. There's a number of patients that will go home, think about it. Sometimes they're going to see other physicians for other opinions. So there's no really any requirement at the time when you come in. So there's no obligation to sign up for surgery. Some patients do elect to sign up for surgery, and we can take care of that at that time as well.
What if I don't pass the preoperative testing?
Then we would definitely need a cardiac clearance or clearance by your primary care physician for whatever it is that you didn't pass. And so sometimes it just needs to be fine-tuned with your medication, or to resubmit the laboratory data. So, but at that point, I look at all of the data that comes in. I look at all the lab tests, look at all of the EKGs that come in. So anything that I see that's flagged, then I would require, one more step from your primary care pulmonologist, diabetes doctor, or your cardiologist to take it one step further.
Is there something I need to do if I decide I want to schedule a certain date?
Well, one of the things that the patient care coordinator will go over with you are dates that you might want to have surgery. So when patients come in, I usually tell them that, the timing of surgery is strictly to the patient, not really based on my schedule, but on their time frame. So our patient care coordinator will have that data available in the computer, and you can look at any dates in the future. Sometimes patients will schedule in the short term, and sometimes patients are looking to do this 4, 5, 6 months from now.
If I decide to schedule surgery 6 months, 8 months after my consultation, do I need to come back in for follow-up with you prior to the surgery?
I usually like that. So my personal policy is any patient that's going to schedule surgery after, a period of 2 months after our initial consultation, I like for them to come back in for a preoperative visit, because we go over a lot of things in the surgery. You and I are going to be on the same page. We talk about a lot of different things. I want to be able to refresh that memory for you. What's it going to be like post-op? What are the requirements? Who's going to need to be with you? Do you need somebody to drive you? Things like that. How much time are you going to need off from work? What's it going to be like? And so I want to refresh that in your memory, because there's no way you're going to remember that in the detail that you're going to need it. So I have patients come back in sort of to touch base. I also, any patient that just wants to do that, they're allowed to come back in as well. So sometimes patients will go home, they schedule for surgery, and they want to come back in one more time just to go over some things, talk about some things they may have looked up or feeling anxious about. And so that's okay too.
If I'm looking at a breast surgery, can I come back in if I think the sizing I did the first time I may want to change that?
Absolutely, and so I always encourage that as well. So when patients come in, especially for breast augmentation, and we actually do some sizing with implant sizers at the time of surgery, it's not uncommon for women to kind of want to make sure they want to come back in, and I encourage that. So if there's no fee for that, there's no charge for it, because I want us to be on the same page. When we show up for surgery, I want both of us to be knowing what we're going to do. The game plan has been set. So anything that you want to sort of talk about before, I would rather you come back in and talk about it face to face.
Do you ever have patients that have one procedure they've decided they want, and when they come back before surgery, they've decided on changing that or adding something to it?
Most of the time, it's not really to change it, but it is not infrequent that they'll want to add something else, especially if we're doing some liposuction. They might want to add another area, and we talk about it. So I'll be able to evaluate that area, see if you're a candidate for it, and talk about it at that time.
Do then they go through the same process, meet with the patient care coordinator again, and have new paperwork set up?
Right, so yeah, so you would have new paperwork. It's just going to be in addition to what you already have done, so it's not going to be the same time frame. It'll be a much quicker visit with the patient care coordinator. So, but yeah, you would have to sit with her again.
Does the surgery center or hospital contact me prior to surgery?
Yeah, that's a great question. They usually will contact you within 24 to 48 hours prior to your surgery. They'll go over, again, all of your medications, your past medical history. They'll talk to you about the medications you're taking, which ones to take, maybe the night before or even the morning of, tell you exactly how to do that, what time you would be, required to be at the surgery center or hospital. So all of that will be laid out for you from their standpoint as well.
Do you know the time frame that all of the paperwork would need to be in by with the patient care coordinator?
We like to have everything into the surgery center or the hospital usually about 2 weeks prior. That way they have enough time to go through all of your stuff like we have, and if they have any questions, then they can contact you or contact me to find out any other information. Well, listen, thank you so much. I hope this answered a lot of questions for anybody who is thinking about having surgery. Follow us along. You can find us on all of the on our website, social media. You can call the office 844-496-6647. If you have any questions regarding this, we're happy to answer any questions for you as well.